arms and legs are the same length. You can come closer. You don't have to sit over.
You start over.
So that's my brief inspection, my general survey. Okay. So the next thing I'm going to demonstrate is palpation. So I'm going to palpate for the texture and the temperature of your skin using the back of my hand. I would also do that on your legs, but not over clothing. So here, put it like that, and just run your. That's not necessarily the order that you would do it in, but that's the technique. Okay. The other thing I'm going to palpate. You're going to palpate when you listen to somebody's lungs. You're going to palpate somebody's abdomen, and so you're going to palpate for hurt tones. But I just wanted to show you briefly what that's about. So I'm going to have you lift up your shirt if you don't mind. Okay, good. So when you're palpating for lung sounds, you're going to use the palm of your hand. So say 99.
99.
99.
99.
99.
99.
99. And you feel vibrations in the palm of your hand. And those vibrations should be equal over areas of lung tissue that's got air going through it. So if the lung was consolidated, or if there was a mass there, you'd have increased vibrations. So that was good. The other technique, since I got your shirt up, is that you could use on somebody's lungs is percussion. Now this is fun, and I want you to practice it on each other. You're going to use your second finger and the third finger. I like to use two fingers because it's hard for me sometimes to elicit a tone. And this is percussion, and you're going to tap. And I'm tapping in between the ribs where it should be hollow. You see here it's kind of resonant. So that's percussion. That's indirect percussion. I'm going to thump you. There's something called blunt percussion, and you're testing for kidney tenderness. And you put your hands right over the kidneys, which is the costovertebral angle here. And I'm going to thump you. And you thump. And if the patient has any problems with their kidneys, like a pyelonephritis, that's very uncomfortable. So that is blunt percussion. Direct percussion is when you're percussing sinuses, and I'm just going to tap you right here and right here. And if somebody has sinusitis, that can elicit some tenderness. Okay? I'm not going to make you lay down. I'm not going to pound on your belly. We'll do that later. But auscultation, stethoscope. There are a very specific way to use a stethoscope. You want your earpieces pointed forward, so it goes in your ear and it fits snugly. If you wear long dangly earrings, that's what you're going to hear, clank, 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 clank. And it's going to obscure any faint sounds that you might hear in somebody's heart or lungs. The other thing about your stethoscope is you want your tubing that's not really more than 12 inches long. It may have a single chest piece like this does, which is both a bell and a diaphragm. Depending on how much pressure I use, turns it into one or the other. The stethoscopes that we have here, this is your bell, and this is your diaphragm. Now, when you look at this, you'll see that there's a little hole there, and that's the active portion of the stethoscope. So if you tried to listen to something with the bell, and the hole was on the other side, you wouldn't hear anything. So you always kind of want to tap. If you're not really sure, you tap it while it's in your ears and gently, and you'll be able to hear it. Let's see. Anybody remember what the diaphragm is used for? What kind of sound? High-pitched or low-pitched?
Low-pitched.
You're right, high-pitched. So you're going to use your diaphragm for high-pitched sounds. Where might you find high-pitched sounds? Any ideas? Lungs. So you're going to use your diaphragm to listen to someone's lungs. You're going to use the bell and the diaphragm to listen to the heart, because you're going to listen first with the diaphragm, then you're going to switch and listen with the bell when you're listening for softer sounds, lower pitch sounds like murmurs and extra sounds. And you're also going to use the bell to listen to carotid arteries as well as femoral arteries, and you use the diaphragm to listen to bowel sounds because those are generally higher pitched. But don't worry about memorizing all that. You won't have to know that, I don't think, for your practicum, because the techniques you're going to be focusing on are using your stethoscope to take vital signs and things like that. But I'm just going to show you, and I want you to get used to using a stethoscope. Does everybody have one? Have you bought stethoscopes yet? Okay, well, we've got plenty here, and you may want to put off buying one until you get comfortable using one and using the different kinds, and then go test them out.